The Communication in Healthcare course is really a course about communication skills to help practitioners really, I think, listen and relate to patients and families.
Medicine is changing, it really is, and it's appropriately all about what's best for the patient.
As we know, healthcare is facing some really tough times. So, how can we still be efficient? How can we still be effective and serve our patients in support of the bigger aim?
To be able to have particular tools to be able to respond to challenging situations, and also the strong emotions that can come out from being chronically or seriously ill.
A lot of times just didn't know where the patient was coming from.
To be able to have something, tools, teachable tools that we could use here at the hospital, as well as, I found that I've been able to use them at home.
This work was really developed through the American Academy of Communication in Healthcare, and we had the opportunity to work with faculty that are currently practicing at the Mayo Clinic. They were here, they trained us over a 3-day period of time to really bring this work to Mission Health.
It helps us connect to our peers and the people who work at the hospital by telling a story about ourselves and something that really made a difference in our lives.
The most important thing to me was about empathy.
So it was almost like I'm coming in to learn how to operate better as who I am, and also how can I shift the culture.
And a lot of people come in thinking they're going to be sitting at a desk and writing notes, and it's exactly opposite of that.
And knowing that what you're doing is, again, not just trying to get up and teach a course, but it really is trying to connect.
We engage them from the moment they walk in and have them take an opportunity to get to know each other. And that somewhat takes this curtain away of suspicion, or really what am I getting myself into, or what was I forced to do.
This is really providing a way and an outlet for physicians, for the other healthcare staff to really come together and be able to talk about these cases in ways that they don't have any other outlet to do.
I remember the first exercise of having to listen and realizing how often I've already got an answer in my head, or I'm thinking about the next step, or whatever. So that was really important, to really listen.
Teach people to communicate, help people to communicate is very important, because that's the biggest tool that you have on your belt. That's the biggest tool that I carry.
All of us as a system, if we don't partner together in every entity, then anything else is going to fall apart. And it's all about teamwork and team building.
And I was just so excited to have it be more humanized, like all of us together. We weren't in any kind of hierarchy of what our roles mean, and we were just there all together learning at the same time.
The purpose of this is to prepare us for our real work, our real life, and they've connected in a way that they bring their own experience to it.
One of the things I think that's really come to me with this course is that it's really all about the patient and family experience.
It was such a great reminder of all the important things that I had learned, but I needed to do just a little bit better.
And it's really given us an opportunity to really look at our whole quality and safety program here at Mission.
One of the unanticipated beneficial effects of it has been that we've brought together people in our medical staff who never talked to each other.
I've seen a big change in the whole hospital, with physicians and nursing staff seem to appreciate each other more and listen to each other more.
Always, every class, somebody comes out with an appreciation for, wow, I didn't know people did that here, or I didn't know that you all had that much stress.
The journey that we have all been on together has been so enriching, and it really goes beyond what I think is just even the core curriculum that we're teaching.
Because we really have an opportunity to enrich our own lives, our relationships in every corner, every facet of life with these tools.
I think what's really resonated with me is the tools that we're teaching people we use in the workplace, but we use them at home, and we use them in any interpersonal relationships that we have.
Well, I have to admit, I was a little bit skeptical.
But when it comes to communication, there's some inherent assumption that people just have it, and that you can't trained to improve those skills. That was my assumption early on. Either you got it or you don't.
The comments that we get back and the comments that you get even offhand from people that you run into when they're in the hospital, when you're in the hospital, that have participated in one of your courses, and they'll say, you know, I really enjoyed that. I didn't think I was going to, but I really think I got a lot out of it, and it's made a difference.
You know, a 4-hour session is going to turn you into, you know, the next great orator, hardly. But it's a start, and again, I think it's just getting that awareness.
I have noticed a significant change in our culture.
We have people who are saying, how soon can I go? Not, do I have to go?
I think it's just wonderful to see providers coming in and just not being sure of what they're coming into and leaving with really the sense that of community and also just this joint mission that we have to really provide the best patient care that we possibly can.
With my staff and people I encounter, they're always like, not everybody's bubbly Brandy. Like, that's always the first comment. But in my bubbleness and glasses half fullness, I see them reaching out, trying to make a difference. I see the approach going differently.
And one thing we hear over and over in my classes is how much the staff appreciates the hospital's investment. And they thank us, they say, we can't believe that directors and managers are teaching this.
You know, as we roll this out, as we all practice it, we are going to have the awareness that everybody we encounter in the system knows these tools. Everybody's going to approach communication in the same way. It's something that we share. It's something we have in common.
And everybody is going to be on the same level and working in the same direction.
Communication is just such a strong thread, and I can see how it fits in the whole of where we're going.
I am just amazed and really appreciative to be a part of the communication healthcare curriculum, because it's not just something that we do, it really has turned into something that we are.